Assalamualaikum warahmatullahi wabarakatuh and good morning to all. I'm Associate Professor Dr Rosediani Muhamad, Head of Department, Family Medicine Department. We'll talk about approach to good consultation. When we talk about approach to good consultation, it means a successful consultation. A meaningful consultation is a two-way dialogue rather than one-way dissemination of information. What does it mean? It means it is a process rather than standalone events in which involve we as healthcare providers and patients. So our consultation usually deal how we deal with the patient, yeah, especially during our history taking, when we want to provide the patient with some information and so on. So before we go further, we should understand the outline of this lecture. Okay, so this is among the things that I will cover during this lecture, where I will make sure that you know the objectives of the lecture. Yeah, after this I'll show you the objectives, followed by some introduction of the topic, the purpose of consultation, the stages of the consultation, as well as the features of good consultation. And lastly, I also cover the pitfall of consultation. So at the end of this lecture, I hope you will be able to know what is good consultation and what is the features that should be in while having consultation with the patient or our clients. So how can we apply these in our practice and also to avoid pitfalls in consultation? Medical consultation actually involves so many things, but the main of the priority is on the history taking itself. Okay, and also it involves during physical examination and how we go about to talk about the management of the patient. In the global pandemic caused by the spread of COVID-19, we know that the infection has affected every people in the world. So this pandemic has dramatically affected our lives, health, economy, and also our peers. And please don't forget our consultation with the patients as well, meaning it affects how the patient assess access to the clinic, and also how we can deal with them during the pandemic, because now we are using more towards internet or website communication, what we call it as telecommunication, or sometimes we use phone consultation to ease the process. So please remember, we are spend half of our life as actually in our consulting room. So please make sure ourselves comfortable with the consultation so that the patient also comfortable with us. Okay, so why we really take care of consultation? Because as we all know, history alone can contribute to 83% of the diagnosis. Yeah, because we try to come up with the correct diagnosis from the history. So the consultation, how we take the proper history, can take the proper history from the timeline. Yeah, I know everybody busy right now, writing up, yeah, all the mnemonics, yeah, mnemonics, yeah. Because of that, uh, we start to not remember what should we do next. Okay, because our mind actually focus on certain things, we just focus what we want to know. Okay, but during consultation, if possible, yeah, even though we have limited time with the patient, give time to the patient to talk with her or his own words to tell us what the possible diagnosis or what the possible causes that the patient have that leads to the diagnosis that we want to make. Okay, other than that, the patient usually know the link with something else, the psychosocial thing and whatnot, so many things. Okay, because of that, the in-depth interview is really important. Other than that, we also can use motivational interview to grab as much as information from the patient. Okay, now we would like to know what are the purpose of consultation apart from we try to give to solve the problems of the patient. Okay, so apart from come up with the correct diagnosis, consultation are important for us to make mutual decision on patient's management. Because after we clock the patient, we do the physical examination, we come up with the provisional diagnosis, okay, or probable diagnosis if we can't really sure of it. So after that, what we need to do is we have to talk to the patient. Okay, this is what we think, this is what the possible diagnosis and the professional diagnosis, and this is the thing investigation we need to do. And from this, what are the management, either non-pharmacological or pharmacological management that we plan to the patient. And we ask the patient which part that they can help themselves to settle their problem. Okay, so other than that, we try to solve any problems also using consultation, provide advisors. We try to improve their knowledge, yeah, their attitude, practice, and try to create trust so that our doctor-patient relationship will maintain excellent throughout the treatment process and reassure once needed. So many things, yeah, all about the link between both of us. Okay, so in order to make sure that this consultation really give comfort to both of us, we as a doctor should appear ourselves confident. Okay, and that because of that, we should mentally and emotionally prepare. So please put aside all other things, maybe things at home, in your hostel, blah blah blah. Maybe your relationship problem, any problem, just put aside and only focus on the patient. Okay, so relax, don't be so hurried. Okay, for the patient also have to prepare themselves, so they also have to come with the feeling comfortable, even though yeah, they will come to see us with pain. Okay. Other than that is how we set for the interview, especially those who want to setting for GP, general practitioner, or private clinic, or if you are given the chance to lead new clinic. Yeah, so you have to have in your mind how to set your room. Okay, so make sure the room should be, have a good enough privacy. You know how we should place the equipment, tables, your seating arrangement in your room. You should have the proper doors to go in and out, because we don't know. Sometimes we have an angry patient, so you have to have a safety netting for yourself. How to go out in the disaster or crisis condition, for example. And then how about lighting, temperature? All of this you should think about, okay? And also the distance of the patient and so on. So this is about meeting face to face, and I hope you go back and learn how to meet them virtually, because we are in the pandemic era. We have to know a lot more. So please go back because I'm not cover this in this lecture, and I hope you go back and do some homework on this and come up with the how to come out or set up with the a teleconference or virtual consultation. So now we can see here how the doctor and the patient sit in front of each other, and you can see is it comfortable or not with this distance and also allocation. So we can see here sitting at an arrangement like this is not so good because it's just like you see you talk with your boss, you talk with your head, but something superior than you. When this occurs, sometimes the patient have some difficulties to talk to you, to trust you, and they might feel inferior. So, where is the patient's chair you think is good enough for us to talk with a patient? Okay, A, B, or C. Okay, so we can see here the differences in GP, especially consultation room layout. Okay, so what we usually use is B. B, how we set for sitting arrangement. How about the distance? The distance, we need to know our own space. So make sure we have some distance so that we can, we can write, we can have our own space. Because if too near, you feel not comfortable as well. And if too the space is too distance between each other, it can cause you can't hear properly, you can be distracted by so many things. So 4 to 9 feet actually is very is just nice distance for us to be with the patient. Anything else we should do before the consultation? Okay, so please make sure ourselves comfortable. So how to make ourselves comfortable is to go and have some knowledge about this patient because we are family doctor. Okay, when family doctor, we are trying to understand patient from the beginning. So have a look at patient's notes before calling the patients in, especially among chronic diseases because the patient comes in and out so frequently, maybe 3 or 6 monthly, come to see you. You might know the patient very well, okay? So that you have some ideas on his latest problem. What is the latest problem which he come to see you, and what was the management during that time, or what do you plan to do next, and either it has been settled or not. So this gives you an idea. How about acute cases? Acute cases, just flip through, just see what's the problem, understand a little bit about patient's social life, if any, from the biodata of the patient, for example, and go through what's the usual complaints that the patient has. Okay, so what should we do next, which is during consultation? So, as usual, ask the patient in and ask the patient to sit down comfortably, greet the patient in order to build rapport. Okay, and talk about patient first, especially on the social background, asking about who the patient comes with, and so on. And when you see the patient is comfortable with you and easy to talk with you, now you have to start with the asking about patient history presenting illness. So how to ask it? We will tell after this. Okay. Other important thing is a good eye contact. Okay, because it's make you really focus. You really want to know the patient. you really want to solve the patient problem. Okay, and please do not write in front of patient. You can write a little bit, just jot down the points. Okay, no need to go and write. Okay, please do not ask the patient to stop first. And okay, wait first. I would like to write this. It's really important. No, you must learn not to write in front of the patient. You have to learn to remember. Okay. So please remember again, jot down only the important things and please follow the timeline. I will teach you during what we call blog during this posting how to take the history. You know we have the framework how to take the history and you have to remember the mnemonic. But if you can't remember, okay, because when you remember, you start to remember things, you start not focusing on the patient. So just follow the flow, okay, meaning follow the timeline, starting with when was the problem occur, what has been done during that time, blah blah blah, what's the status of the diseases, chronic diseases, and how is it in terms of management? Is there any changes? If yes, how or why? Use uh, 5W and 1H. Yeah? Please ask anything using open-ended question. And please understand the sequence of the problem. If you understand the sequence of problem, so you can remember the patient by heart because you understand the sequence, just like you read the storybook. Yeah, sequence from this part. Okay, this is when he was diagnosed 10 years ago. So what happened during this time? What blood investigation has been done? What other investigation has been done? Is there any complication or not? Micro, macro, for example, for chronic diseases. List everything and how these change with time. Okay, status of the disease, okay, the status of the complication, the status of the management, and so on according to biopsychosocial things. Okay, and please give the patient chance to express their idea, concern, and expectation. What will be what are the ideas that the patient think the patient might have that cause this problem, for example. Okay, and what are the concerns of the patient? What patient need? Patient want treatment, patient want someone to share, for example, uh, or what else? Okay, and the expectation from coming the to the clinic. And our part, okay, are listening. Okay, listen is really important. So how to listen is to provide open-ended questions. So you just facilitate them to talk. Okay. For example, yes, go on. Please tell me more on this. Please elaborate on this. Okay. I'm not sure about this or I'm not understand about it. Can you tell me more? Okay, something like that. And you should show me your interest. Okay, from your body, language, from your eyes, yeah, how you see the patient, everything that show to the patient that you really want to hear their point. Okay, and please leave the directive questioning, meaning the close-ended question at the end. You open first and then you close it. Because why we would like to know more? Because sometimes cues are often missed because we are not listening, because we are focusing with what we want to know. We want to know a medical problem. We just go directly, is there any this, is there any that, and blah 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 blah. Because we just want to know what we want to know. We don't want to know what the patient wants to tell us. And because of that, the cues are often mixed. For example, we have patients come to see us with a chronic headache and was treated so many times. The patient don't have a high BP, nothing, no migraine. Yeah, she was diagnosed as tension headache on treatment, but still having the problem. And lastly, it come up with a sexual problem. So please give your ears, listen carefully. Give your eyes to make sure you listen carefully so that you just drop your hands not to write so many things so that you can understand what the patient's problem. Okay, so some tips for active listening. The first one, please make a good eye contact, and then you can adjust your body posture. It's really important how you face the clients, how you sit on the chair. So it really gives some ideas to the patient. And give verbal and non-verbal acknowledgement. Okay, can you tell more? For example, okay, okay, I understand this. So please clear your mind because your mind you have to focus. If not, you cannot grab what the patient wants to tell. And please avoid distraction. For example, a phone call, reading the WhatsApp, reading the emails, yeah, receive things outside from your room. Please avoid distraction. Please take it as minimum as you can. Apart from that, please look out for the important leads, okay? Important cues, verbal, non-verbal, and follow them up, okay? So please do not assume with what the patient tell you. Every time you, you think you need more clarification, please ask. Do not assume, oh, this patient have this. No, you have to ask and make sure you know in detail. This is particularly important when exploring patient's understanding of his problem and its impact on his life. And also please use the language that patient can understand very well. Use the patient's mother tongue. So I know you might think about how we can do it in primary care setting because we have limited time. Even though we have limited time, you have to plan. What is the most important thing you have to gather during the first visit? What should you ask later in the next visit or the other visit? So you have to plan. Oh, this kind of patient, okay, you have to get at least this much during this time. Okay, next time we will go further and dig further, for example. Other nonverbal languages is kinesics, for example, gestures, body movement, proxemics using the space, how we use the space, paralanguage, how we tone out our voices, and also object language, how we put our clothes, how we dress, and so on. Okay, next is about other things. As I mentioned earlier, is how we encourage the patient to tell their story in their own words. Okay, as we also tell you before, this is how we facilitate them to talk further. Go on, tell me more about this. What happened then? Can you tell us how do you feel about uh, this being? Okay, so then you give some non-verbal languages, for example, head nodding, looking attentively, and also a good posture. Okay, other than that, we have to listen, right? Give the patient sufficient time to talk and avoiding coming in too quickly with questions or reassurance. So at the end of the consultation, yeah, you try to review back. You try to summarize the history, and this is very important to allow correction or if any misunderstanding occur during the consultation. So go back and revisit the points and ask any things that you feel uh, still not sure about. So these are among the examples. Okay, you can things that you should not use as things that you are encouraged to do. For example, any problem? Why do you come today? It seems like you are not willing to take the patient. Your headache, is it over both side or which side? Do you have nausea, vomiting? Are you depressed? You don't breathe very well. You are losing weight, appetite, sleep. So all about close-ended question. So please choose other words. Okay, how can I help you? Pakcik, boleh tahu apa masalah dan bagaimana saya boleh bantu pakcik, for example. But I know what made you come today. Okay, apa masalah yang boleh saya tolong bantu? Atau can you tell me more about your headache? Anything else you want to tell me? How was your mood at this time? How was your breathing? What about your weight? So the words that you use is really important to accelerate more or generate more knowledge about the patient. So this is what Egan said. You can read it because he listens with eyes and his sense of touch. He listens by becoming aware of the feeling and emotion. This is how we should go about. But because of I understand we have limited time, but please try to at least if you have 20 patients per day, for example, please practice it among 5 patients, for example. Maybe during that time the patients are not so many, so you can try to practice it properly and make it as your habit. So just go read what Egan said and then you understand what should you do during consultation. So how we should ending the consultation? Okay, what we should do is the most important part, we have to inquire if there is anything he would like to add before we finish asking or we finish our consultation. Okay, so then you can either you can summarize or you can say to the patient, okay, we examine first, we try to find any findings that can help in making the diagnosis, and later on discuss about the management after you tell the patient the diagnosis and what is best for him. Okay, after that, after talking about what is best from our knowledge, we have to ask the patient what the patient can do from his part to help him to reduce the pain or to solve their problems. Okay, for example, patients say like, okay, you say, okay, it's good for you to go to swimming, for example, do some jogging. Okay, or cardioprotect is very good for your cardioprotective and to reduce your cholesterol, blah 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 blah. You can say anything under the sun, but if you don't go and ask what is the usual thing that patient do and how the patient want to help himself, how you must ask the patient because we would like to know the patient's ability. Because sometimes if we say something, the patient don't want to follow it. So it's just losing all the energies out into the drink. Just go try to bring the patient on the track, do step by step. Okay, it's okay. It's just like you go and walking around the house. Maybe today only 5 minutes, 3 times a week, and then later on, if patient feel comfortable, go up to 10 minutes, and later on, 15 minutes, and subsequently reach the target. So this is how we should go, so that patient feel easy, yeah, to help himself or involved in managing his own disease. Okay, now we go to common pitfall when interviewing patient. As we all know, we already gone through the eye contact. Yeah, the poor eye contact really makes the patient feel frustrated, or over reliance on notes, over reliance on systematic inquiry, because you are stick with the mnemonics, what to ask next, what to do next. So you just try to remember that without understanding the patient as a whole, or you come up with a premature discussing, yeah, or focusing down on the perceived problem. You just want to focus on certain things prematurely because you think you don't have time. Actually, you try to cut and try to assume. This thing is really uh, occur. We can see during our clinical teaching, yeah, later on. You can see how you come up with the premature focusing on certain things. Yeah, because of that, when we ask, can you tell us how the patient take the diet? Because you say, oh, the patient take the healthy life, adult diet. Yeah. So what does it mean? Adult diet is no meaning to us. Adult diet is not similar from one individual to another. So you have to understand what has been taken by patient from early morning until he set for sleeping. So you have to understand. You want to go by carbo, by what food pyramids, or you want to go by pinggan satu Malaysia. It depends on your creativity, so that you can come out yourself how to advise the patient according to patient's real world, a patient's real diet history, yeah, so that you can modify and you can discuss with the patient how to modify. If you just tell us about, yeah, the patient just take normal adult diet, nothing can help us to manage the patient. And the lack of clarification, so many things you can see. Once you can't answer others' question, for example, when we ask you to tell us further on certain things and you can't answer, that's mean you don't really take the history in depth. And failure to follow the patient up, especially on the cues as to what they think the problem. Because we have to remember during history taking, your mind should work as well. It's not just you looking at the patient, what, without thinking. No, your brain has to work fast to make sure you know what are the possible and probable diagnoses for this patient. So what some serious diseases that the patient might have, for example, okay, and so on. Or is there any hidden agenda or cues or something else from this history? And other than that, deficiency in the question style. So we have to practice on this. So make sure you know how to ask the question properly with appropriate words or sentences. And omitting to ask what the patient's idea are about the problem. So one of the problems. So some difficulties usually occur when we try to diffuse patient anger before starting on the consultation. Yeah, so make sure when we talk, please please remember patient's heart as well. Patient's feeling. I mean, okay, so even though you plan to just kill it, for example, but with the patient, you might use a formal way of consultation. Okay. Those accompanying the patient should never be ignored, but may be proper attention. So please also address the carers or those who accompany the patient because we might need them to support the patient in the management as well. So please remember, in summary, please be professional. So there is a lot more to do. It's more to be a doctor than just acquiring a medical degree. Because a doctor, you have empathy, you have listening, you have so many things. Your status even higher, and how you try to level up with the patient to make them comfortable with us and able to share as much as possible information to help with us to come up with the diagnosis and better management. Whether we like it or not, we are the example and the opinion leaders in the community. So please behave ourselves in whatever ways in how we put our attire, how we smile, how we talk, how we behave. Okay, so many things because the community actually looking at us and they might judge us as well. Okay, so please be a good example. And then good manners cost nothing and make life a lot pleasant. Okay, so make sure you have a good manners. And please remember ethical standard in medicine. We have to know our own ethics. Remember our oath. We have medical oath and also we have Islamic oath for Muslim. So make sure we understand all of this because we have to learn and we must to practice well during our consultation. Okay, in summary, we have to be professional at all times. Okay, before we end up our session, so please make sure go back and read about successful consultation in virtual consultation. I mean, yeah, because this one is about face to face. Yes, a lot of things actually covered here, but maybe something that we must add for virtual consultation as well to make sure the result is at par with the face-to-face consultation. Okay, that's all. Thank you for your attention and Assalamualaikum warahmatullahi wabarakatuh.